back to my channel. Yeah, in today's video I have a wonderful guest, a pretty person, a beautiful person. Meet my beautiful guest. Hi everyone. Yeah, so let us meet to your name, your social media handles. Just talk about yourself.
Okay, my name is Majakudumi Shadai Luatobi, as inscribed on my scrub rather. My social media handle, you can follow me on Instagram. It's Toby Sassy on Instagram.
Okay.
I'm a nurse by profession, basically. Hence the wearing of scrub today.
Okay, thank you, and thank you very much for coming, for honoring our invite.
You're welcome.
So in today's video, we're talking about career advice and guidance for nursing. So we have our guests. You treat all questions, how to go ahead with your nursing career, what you can do. You don't need to run away from the country just because you want to study nursing. So we're talking about everything today. So don't go away. Stay to the very end, and I'm not sure you'll be dedicated.
Okay. Let me first start with nursing, then we'll move to career. As everybody knows, we all know what nursing is. What I mean by that is, at least you've seen a nurse before in an hospital and you know what they do. Nursing is a caring profession. Like, the profession is for caregivers, basically those that give care to patients, and they're always involved in their health. In fact, when I mean health, not just in the medical aspect, but physical, social health status of a person. So that is what nursing is about. Now, moving on from that, we'll now talk about nursing as a career. So it's a different ballgame when you are still a student, like you're a nursing student, or like when you are now a nurse working in an hospital or whichever place you are going to be working. I'll still come to that very much later. So it's this career advice or career guidance and all of that, really, to be honest, it is so broad, but I hope you'll be able to listen to the end so that we'll be able to like break it down like little by little.
I want to ask this question: that how can we start our career as a nurse, like as a nursing student or as a nurse in general? How can we start your career if you have it in mind?
Okay. So if you have it in mind that you want to become a nurse, either you have studied something before or not, you are to go to a nursing school. Now, it's either you go to the College of Nursing to get your diploma, or you go to a university to get your degree in nursing. But either ways, all is still okay and fine, because on the long run you would still have to sit for nursing council exam, whereby you would be registered under the Nursing and Midwifery Council of Nigeria. Yes, that is to show that okay, this person is a registered nurse under the board in Nigeria. Then you can go to practice in Nigeria, like anywhere you want to. Yes, anywhere you want to, at least within Nigeria, you can be able to practice.
Wow.
So, and the requirements, well, let me start from like aspiring students. Let us say, okay, maybe you wrote JAMB and all of that. Okay, now for some people they wrote JAMB, but maybe the JAMB is not favorable and all of that. You can switch to go to a school of nursing, whereby you can write your entrance examination. After your entrance examination, you would go through another process of interview. I didn't go to a school of nursing actually, so I know that you would go through another process of an interview. Then after that interview, you would have to, then you cross into your, I think weeding process. And after weeding, then you do your capping ceremony. Then you are now okay. Yes, fine.
Wow.
You are now a bona fide student.
That's the whole lot.
So like the way you do matric in the university,
Okay.
that is what that capping ceremony is
all about.
Is all about in nursing school. Let's not forget, nursing school is not a university. But in the university, you might not really go through all of those capping, this and that. If you are in 100 level in nursing, you are in 100 level, and that is it. So that is for those that are aspiring away from JAM. Now, if it is that maybe you study the course either related to nursing or what I want to do your direct entry to nursing, well, recently, before it was not like that, but recently, nursing don't accept direct entry. Yes, for a particular age to like there's an age gap for it now.
Wow.
Though to be honest, I didn't really find out the particular age gap, but I know for sure that there's an age gap to it now. So which means that they are trying to curb those that are already established in their career before.
Okay.
They now want to cross to nursing because they heard that nursing is going to give you money when you study it and Japa.
Okay. What is Japa?
Well, please, that's just on a lighter note. I don't know why, but there's really a age bracket. Yes, there's an age bracket to it. So if your age does not fall within that age bracket, that means you would have to start nursing as 100 years, like 100 level. And really, to be honest, if you would ask me, well, 2 semesters do not bite. This is 100 level. In as much as you are going there for your passion, why not? Why not do it? After all, me too, myself as a person, I studied the SLT when I was in the Polytechnic, and when I wanted to cross back to nursing, I didn't even bother to take direct entry. Like it was 100 level straight up. So 2 semesters. In fact, I did physics and chemistry all over again.
Yes, 100 level. You have to do
so I did physics and chemistry all over again. So, but either ways, 2 semesters do not bite really, and on the long run, you just before you know it, you're already in your 200 level. So what's the big deal? Wow. What's the big deal in it? So some schools, I think it's 5 years.
Yeah, 5 years.
So it's 5 years. But I'm hearing that some private schools are doing theirs 4 years.
Really?
Yes, I'm hearing that some private schools do their nursing for 4 years. But please, the standard is 5 years because there's no way now you'll be able to cover the syllabus of nursing for 4 years. Because you still have to do clinicals, practicals, like in fact, I know that your year 3 and year 4, half of your stay in school would be in the hospital doing clinicals and practicals, basically.
Wow.
So
thank you very much. So I want to ask this question, like after you're done with school, how can you work? How can you start up your career? What are the things you need to do after school?
Okay, so well, I would use myself as an example and I will explain how. In my own school where I studied, oh, by the way, I didn't study in Nigeria though. I just came back to the country to start practicing in Nigeria. But either ways, it is still the same thing. Now I will explain. For me, when we wanted to do our clinicals in school then, like they exposed us to different aspects of nursing, which is you like it's not just bedside nursing that medical and surgical nursing alone. The way like normal nurses do. You know, they took us to pediatric ward, that's ward for children. They took us to gynecology ward, that's ward for women. Obstetric and gynecology actually, obs and gyn, the two together. Pregnant women too, they're involved in obs and gyn actually. Then they took us even to the psychiatric ward.
Wow.
Yes, for those that are mentally disturbed. They also took us to community health setting.
Wow.
Yes.
Oh, that's very good.
Yes, so like they took us to like different parts, at least we should have an idea. In fact, Yes, in fact, when I even now crossed back to Nigeria to practice, because I am to write nursing council exam here in Nigeria, they also took me to orthopedic ward. Yes, that's for those that are having bone issue and all of that. Yes. So like they even took us to accident and emergency ward. So which means that and yes, in my own school they took us to the theater. Yes, they took us to the theater. So which means that like you already have an
Many
idea.
options.
Yes, you have an idea of okay, this is what I would love to do.
Do.
This is what I would want to really specialize in.
Mm.
So when you are out as a fresh nurse intern, actually, not because when you write your nursing council, I forgot to add that when you write your nursing council, you are not immediately like going to work as a nurse. You are going to be working as a nurse intern for a year. Then you will now do your service for a year. That's for those that are going to the university.
Oh.
But
So that is probably how many years?
That's 7 years.
7 years.
Yes.
I was supposed to be between nursing and medicine.
Well, to be honest, to the doctor that is watching this, don't come for me. But it is the truth. Most of the things we do in nursing is the same thing in medicine. We do anatomy and physiology. It's the same thing.
Basically.
We do pathophysiology. It's the same thing. The only difference is just that when when we go 6/10, they will teach the doctors 9/10.
Oh.
Yes, but it is still the same thing. It's just that in medicine they tend to go deeper because they are the ones consulting with the patients. Our own is just to administer. Yes, we are not assisting them actually.
Okay.
We are administering what they said
to the patient.
Yes, like it's just it's just like a pastor and an interpreter. You can't call the interpreter an assistant pastor. You understand?
Yeah.
Yes. So in fact, in case you don't know, the interpreter is also a pastor in a way. Yes, because if I don't understand the pastor's language,
there's no you can interpret it.
Yes.
Wow. That's a very
so we are almost, in fact, everybody is working hand in hand. We are all
we need each other.
Yes, we just need each other to do one or two things. Without the nurses, the doctors cannot be able to do anything, and without the doctors, we can't do anything. In fact, let me now even tell you, there's another part of medicine that can even render nurses and doctors useless, which is the lab scientists. If the lab scientists is not around, how would they run tests?
Yeah, that's
so
true.
Like everybody is really working together as a team. So there's no way how you would just remove one person. This one is not important. This one is the boss of another person. The way patients used to do now. Like,
I want to see the doctor.
It's the doctor I want to see.
Okay. Continue.
Maybe the doctor will still come back to meet me.
Yeah, that's true.
You just go ahead. So before I lost my line of thought, I was talking about nursing council. Yes, that I was saying you have to be a nurse intern. So during the period of when you are a nurse intern, there's no way how you would have an idea that okay, they would even take you to different wards, just the way they did when you were in school. They will still take you to different wards, but this time around you are not going there as a student nurse. Now you are going there as a proper nurse. Yes, because you are working and you are collecting salary, so which means that you are responsible for your action. So it is a different ball game entirely, rather than saying you are a student nurse. Yes, like to be honest, it's a different ball game entirely. So all of those time is just an opportunity for you to build your career, to build whatever it is that you have. To be honest, that's like really. So when you are out of internship, you have an idea of what you want to do. But at the same time, Nigerian government, when we want to plant and want to eat apple, that's when they will throw lime at us.
You're not going to them money. This is Nigeria, No, they don't record anything at all. All is well. All is well. No wonder that some people are trying to Japa, funeral pasture.
Well, to be honest, I am indifferent about Japa thing, because why is that? Is because I know many people will disagree with me on this. Well, disclaimer, this is an unpopular opinion. So like it is not something everybody says, but I understand and I get it. Now, it is good to go out to look for greener pastures. To be honest, it is good.
Yeah.
Because everybody's looking for a better life. Because on the long run, we are being underpaid. But what is your gain when you go there and you are not going there as who you are supposed to be? Like you, let me explain better now. You are going there as just an RN, like a registered nurse. You're just going there. You want to go and work. Hello. Why can't you build whatever it is that you have right here in Nigeria? Yes, it will look as if you are wasting your time, but I will not lie to you. You are not. You are not wasting your time at all. This Japa syndrome, as to be honest, I think I have quite a number of friends that, in fact, they finished nursing school before me because I went to the university. They went to the school of nursing, so like they finished before me. I'm talking of 2019, 2018, before the corona. Like everybody was okay. So, and in fact, they went ahead to do their post basic, and their post basic is more or less like double qualification. But in case you don't know what post basic is a specialization course, just like masters. But yes, but if you are doing masters in nursing, that means you are trying to consider teaching as like a nursing educator. But if you still want to be in the hospital line and want to still keep treating patients, then post basic is for you. So all those words that they took you to, like the pediatric ward, this one ward, that one ward, you can specialize in those things by going to the post basic. Yes.
So that means you can go to the school of nursing and after that go for your post basic. Yes,
definitely. Wow. You can. Okay. Either you are in school of nursing or you graduated from the university, you will still do post basic. If you want to, please, it is optional.
Okay. Then how many years does it take to do post basic?
Post basic, depending on the school and the course that you are doing. But no post basic exceed 18 months. Okay. No post basic exceed 18 months.
That is 1 year.
Yes, like a year and 6 months you should be done. It's not it's not a 2-year course.
It's not too much.
It's not too much.
Still okay.
It's not too much. It's still okay. Though a bit expensive, but on the long run, you will thank yourself for it.
For going for it.
Yes, for going for it. You will thank yourself for it. You will thank yourself for it.
Oh, that's amazing.
So this Japa thing, I don't even know where to even start from, so that I will not offend a whole lot of people, but I will still have to say my mind because I know it's an unpopular opinion, which is that going there, you have to go there and equip yourself first. So okay, I think I was watching a video and Elipop was saying something that why Nigerians go abroad and they don't get the what is it called, the treatment they deserve is because they cannot be able to defend their certificates that they have. Wow. Like you on all grounds you cannot defend it. I'm not in fact, those that are there, they are not telling you to have upper credits or to have 2-1 or to have, they are not interested in all of those things. All they are that's why sometimes anybody that even has HND or 2-2 can do masters abroad. Now, the point is they just want you to be able to defend whatever it is that you have. So now, and meanwhile, when you have your RN, I am not saying you cannot defend it, but give these Oyinbos the chance for them to give you that platform to defend what you have. Because on the long run, when you are not double qualified and you say you want to go there and go and treat their patient, do you think they don't like their people over there? For the fact that they are short, yes, for the fact that they are short staff does not mean that they will just pick anybody randomly on the street and say, okay, come and treat our people here. No, they want to pick somebody that really does what he or she is doing. In fact, when they know that you know what you are doing, they can give you a visa sponsorship in case you are not, like, they would sponsor everything. Wow. Yes, they will. I know a friend that when she finished her school, oh, by the way, shout out to Temitope. Itogbe. No, baby girl, we've drifted apart for like so many years.
Wow.
But one thing that I know about her is that when she finished her school of nursing, I think at some point she was even trying to do a BSc.
Wow.
And at some point, I know of the fact that she went to for post basic in perioperative nursing in UCH. That's University College. Yes, that's Ibadan. So like I knew when she was doing her perioperative nursing, so she's double qualified already.
Wow.
In fact, this person that I'm talking about, why I can be able to mention her name is because like she's my baby girl. Anyway, she worked in one of the biggest hospitals in Lekki before she even traveled out of the country. Yes. So like our going there was based on like visa sponsorship. Yeah. So basically, with all of that she had done, like she was still able to like stand firm even when she traveled out of the country. So in all, I won't say you should not japa, but make sure that you have enough ground and stance for you to be able to defend what you have out there. Like it is really important. Don't just go out there and begin to work like an ant when you have something inside of you that is like an elephant. Like it's no, seriously, it does not really make sense at all. Yes, so that's all I can say about the Japa stuff.
Okay, so she's saying that she's not against Japan, yeah, but at least have enough ground, build your career here in Nigeria, and make sure that you can actually defend your result, defend your certificate, defend what you've got, so that when you get there, you become hot kick, not that you get there, start doing what is not, when you know that you have more in you that you can actually offer.
True.
Yeah, so that's what she's saying. So in a nutshell, a nursing career is very nice, and you can pursue that here in Nigeria and be successful. You can even establish yourself if you have the capacity.
Yes, why not? You can, though there's a clause to it.
Okay.
You are not permitted to own an hospital in Nigeria, but you can own a clinic.
Okay.
Yes, like, but you must have gotten to like a particular level. Most possibly, I think there's something called nursing consultants, and that is when you've done like PhD.
Okay.
Nursing. So then, like,
wow. So there's PhD nursing.
Yes, you can consult.
Wow.
Like as a nurse, you can consult as a nurse. So it is. So you can now have your own clinic, but it will not be an hospital. Yes, to be a clinic whereby just minor what is it called, health conditions are being taken care of.
How about delivery and all that? You can actually have that in the
being a midwife is not bad now. Being a midwife, to be honest, being a midwife, especially in Nigeria, most of the hospitals in Nigeria don't necessarily even need a doctor to perform midwifery activities. Yes, because when you want to conduct a childbirth procedure, you might not necessarily need a doctor on ground, especially in Nigeria. Most hospitals in Nigeria don't really have their doctors on ground. Yes, I think maybe for government hospitals, yes, you see doctors on ground, but like private hospitals, most especially you might not see the doctors on ground, except maybe the condition of the person is a bit complicated.
Get the transfer.
Yeah, maybe the person wants to get a transfer, or most possibly even do cesarean section. Yes,
you need a doctor.
Yes.
Thank you very much. Thank you for the educative talk. Thank you for the career talk. Thank you for everything. We really appreciate you for coming, and we'd like to have you once again. Okay. She said it. Okay. We'd love to have you once again. So please let us know. Okay, you said your Instagram handle is Uluwatobiloba. Okay, I'll drop the name on the screen.
Exactly.
Okay.
My Instagram handle will be on your screen so that you can be able to follow me. Alright. It seems now I'll start posting nursing tips.
Okay, no problem. It's actually cool. Yeah. So don't forget to subscribe, like my video, and share to your loved ones. And don't forget to drop your comments in the comment section. Yeah. See you in my next video. Bye.